We interrupt this regularly scheduled broadcast to bring you this special update.
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 Your update will begin in 3, 2, 1.
Be ready. Ready. Yeah, be ready. 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 Ready.
Honorable MP, leader of UP, thanks so much for joining us here for the UP update this week here. And of course, we know that it's getting closer and closer to the time. You know, August 29th is right around the corner, and we're happy to hear from you where you can update all of us and tell us some more things about what's been happening during the election and what you can look forward to and what we all can look forward to throughout this campaign. Now, let me start by asking you, how has it been going so far overall? What is your feeling from the public, and what is the feeling of the Up Party so far throughout this campaign?
Well, good day, Rolando, and thank you for having me on Update. It's a real honor and privilege. The campaign has been going extremely well. I will say that the people of Saman have responded very well in terms of the meetings that we've had. We've done, I believe, 3 of them thus far, and each of them have grown tremendously in the amount of people that have come out. So it's a positive sign. I think that the message from the party and the message from the members and the party and the list is coming forth very well as well. The issue of no coalition is, I think, coming out to the people, and the people themselves are resonating on that, and the fact that they really have seen that for 4 years the change of government every time a carnival comes around should be something of the past. They feel that again that St. Martin needs a stable government if we're going to move forward, if we want to create jobs, if we want to create housing, if we want to create stability in the country, that it means that we need a one party in government, and that's what we're continuing to push for. And if I'm looking at the crowds that are coming out to our events, I can tell you that it is looking very good in that direction.
Yes. Okay, so you highlighted some of the things that the people out there. One of the things a lot of us know about you is that you really have your ear to the ground when it comes to the society and what are the people out there looking for in their candidates. What kind of feedback and overall would you say our electorate has looked out from you, and they want to see, well, Theo, these are my concerns. This is what I want from the person I vote.
Well, the issue of the healthcare position, especially about the hospital, has come out very well. I personally and many of the candidates, we go to the districts themselves and meet with people. I think on a daily basis, I try to meet with at least about 100 people a day.
Oh, wow.
In groups of 30, so that they can not only hear me, because I'm tired of talking as well, but also letting me know their concerns. I've had very diverse groups of people meeting with different segments of society. But one thing I can tell you in going to the districts, we have a lot of social issues that need to be resolved in housing, in proper facilities for the people themselves, helping our elderly out in terms of how their living conditions are, making sure that we get jobs for our young people, making sure that the healthcare in our country itself is second part to none, because again we are spending so much money sending people abroad, and not only sending them abroad, but they're away from their families as well, and that is a hurtful situation, because you always want to be close to your loved one when they're sick. So I will say again, the positions that we've taken in terms of the campaign are coming across very well to the population itself.
Okay, awesome. Now, I mean, some of your the people out there that will say, well, Theo, okay, you mentioned some of the social aspects, but they say, well, Theo is not interested in social aspects. You're more interested in bigger projects. What is your response to some of that criticism that you might get out there?
Well, I'll tell you something. I haven't tackled the biggest project yet, and the biggest project is the people of St. Martin. So I'm very interested in being able to tackle that project. And you have to realize that in a coalition system, parties have certain portfolios, and they have to work on the portfolios that they have. If you get involved in another party's portfolio, they get very upset. Their toes become very long, and then all of a sudden you're going to hear that government is falling because you're questioning. For the last years, I've questioned, what are we going to do about the hospital? And every time you're hearing, well, we're working on it, working on it, working on it. I mean, you can't, for 4 years, you can't say that you're working at it and nothing happened. I've stated before, not even a pillowcase has been changed in the hospital. So we're looking at not only changing the pillowcases, but changing the entire structure of the hospital. You can't just wake up after, 37 years the hospital has been from plan to construction to where it is now, and wake up one morning and say, well, it's in a flood zone. Where are we going to build a hospital? On top of a mountain? Then you're going to have environmental issues. I mean, this is all just ways and means of trying to destabilize the morale of the people. We know we can build a hospital. We know we can build a multi-level hospital. So it doesn't matter if it's flooded or not. Well, guess what? All the floors are still working. So you can build around that. And we are not looking for excuses to not to build the new hospital. We're looking at ways and means of doing it and making sure that it's finished for the people of St. Martin.
Right. Now, also in terms of the hospital, we see the public feedback and interest in this, and of course, some of the detractors might try to say, well, what about it just, okay, you create a hospital, but what about it becoming, quote unquote, an empty shell? What is your response to that type of criticism? I know that must be very annoying to see something like that, a little politics being played in terms of a very great project. But how can you still clarify what it would be the next step in terms of the hospital?
Well, in the steps, one, if you want to attract world-class physicians, you're not going to put them in a facility where the tiles are falling off, there is no equipment.
Right.
Imagine that for the last years, the hospital has stayed the same size and the population has nearly tripled or quadrupled.
Yeah.
And we haven't added a bed to the hospital. We haven't added a new surgery ward to the hospital. We haven't added anything new. So how are you going to attract new surgeons, new doctors to the island? How are you going to give incentive for our local people to want to study medicine when they know when they're coming back? They're operating in a system that is so old and antiquated, not up to the new technology, not up to the new standards of healthcare in the world. You have parties that are talking about renovating the present hospital. Imagine you, Rolando, on the bed, you're sick, and then you're hearing jackhammering, or your cement dust is throughout the hospital and sighing and everything. I mean, this is crazy. I mean, how do you renovate the hospital when people are going to be in the hospital? So that's why our position is build the facility. At the same time, while building the facility, we've already started discussions with medical facilities in the US, Canada, and Europe as well, to look at doing what they call medical tourism in the country. They can also now bring patients to St. Martin, operate on them in St. Martin for a significant cost savings versus the US and Europe. And those same doctors then can also treat our patients here on the island. In addition to that, then when our young people are starting to see a new hospital facility being made, we can then give incentive for them to go away to study for scholarships. Now remember something, for you to have a person study medicine, it takes you nearly 8 to 12 years to before you become even a medical assistant or whatever. So it isn't that any party that's telling you that they will bring in all of these specialists and everything as well, and they're all going to be local. They're just telling you nonsense, because in the 4 years that you're going to be in government, you're probably the only physicians that you're going to be getting is those that have already started studying many years ago. So you have to come up with a plan, not only to build it, of course, but also in looking to stem that facility to bring in new doctors and new physicians and new surgeons. And that is something that we've already started working on. We've already had discussions with the board and the management of the hospital in being able that they manage the facilities. Not that government manages the facilities of coming in, but that they do it. So they know. It'll also create jobs for new nurses, new employment opportunities. And these people, when they're coming in from the US to do their medical surgery or whatever, that means their family members are coming in. That means they're going to stay in our hotels, eat at our restaurants, use our taxi services, you name it. So what we're doing with the medical facilities in St. Martin, not only we're taking care of the people medically, but we're also taking care of them financially, because now they're making more money. If we can have a regional port, one of the best in the Caribbean, and also a regional airport, one of the best in the Caribbean, why not also have one of the best regional hospital facilities in the Caribbean?
Correct.